Welcome back. Francie Stoner, President and founder of Laugh Foundation, and this is another in our series of docu-series, helping you make your way through all of the coronavirus issues and situations. And I'm honored, pleased to have Joseph Scaletta back with us. Joseph is the nurse consultant for infection prevention and control for the Department of Defense. And now he's going to be telling us about contact tracing and all of the crazies. How do you figure out where this virus is going and where it's been? Joseph, thank you for being with us again today.
Francie, it's my pleasure. So today we're going to be talking about contact tracing or contact investigation, which is a tool in public health's toolbox that we use in order to promptly identify new cases of diseases as they spread. So I'm going to share my screen because I think a picture tells 1,000 words. And I think this slide does a really good job of highlighting just the interconnectedness of all of our lives. We certainly have a range of people that we interact with frequently. Probably most common, we interact with our family or those that we live with. We also interact with shopkeepers and people that we ride public transportation with. But each of those need to be quantified in such a way so that we can assess risk, especially when we're talking about COVID-19. So contacts are defined by CDC as someone who has shared your space within 6 feet of a COVID-19 case for greater than 15 minutes. So close contact sometimes occurs when caring for, living with, or visiting someone with COVID-19 disease, or having direct contact with those infectious secretions of a COVID-19 case. So when we are talking about contact investigation or contact tracing, the goal of this is to identify these people that are defined as close contacts, not necessarily all of our contacts. So what happens if you get a phone call one day saying that you've been identified as a contact of someone that has COVID-19 disease? Your phone will ring and you'll pick up. Hopefully the person who's initiating this conversation will identify themselves as being part of a public health agency. Sometimes this is a state health department, and other times it's the local health department. Every state does it a little bit differently, and it just depends what your state has the capacity at the local level, or if they turf that to the state level. At the beginning of the conversation, they're going to identify themselves as being from the public health agency, as well as describe the interview process and assure you of your confidentiality. Anything that you say to someone during the process of contact tracing is generally confidential, and we'll talk a little bit about that coming up. Once they get your permission to continue with the interview, they're going to ask about your recent symptoms of COVID-19 disease. Those symptoms are going to include fever, cough, loss of sense of taste or smell, all the things that we normally suspect when we are trying to rule out COVID-19 disease. They might recommend, if you are symptomatic, that you be tested, and they'll describe what that testing process looks like and where you can seek medical care if you need it. They're also going to talk to you about when, if your symptoms worsen, when you should seek medical care as well. If you're not symptomatic, they may recommend, based on the nature of your contact with the person who was diagnosed with COVID-19 disease, that you maintain quarantine, meaning that you are staying in your house and not going outside for up to 14 days since the last contact with that individual, or isolation if you are symptomatic. One of the most important things that they're going to review with you is just if you do need to seek medical care during this time, that you should inform your provider that you've been named as a contact for someone that's been diagnosed with COVID-19. That not only helps the facility or the doctor's office prepare for you to come visit them, but it also lets them know that they might have a lower threshold of suspicion if you do have symptoms, and treat based on that. So I know there's a lot of concern about privacy, and privacy is maintained with the public health professionals. The data is only going to be accessible to public health, and they're using that information to really flatten the curve of COVID-19 disease. You're likely not going to be told the name of the individual that may have exposed you to COVID-19, and that gives you assurances that you can freely talk about who you've had close contact with to further the investigation. One thing that's super, super important here is that if even one contact is not named, then there's potential for that disease to continue spreading. So even if you don't think that you've had close contact with someone, let public health figure that one out, and be inclusive in describing who you've seen and where you've gone and what you've done. I hope this has been helpful, and I wish you guys the best of luck. Hopefully we'll talk soon.
Joseph, thank you. Oh my gosh, it's a fascinating topic and so many questions that were answered today. I so appreciate your being here with us, and we wish you great health. Stay safe.
Thank you. Keep washing your hands, guys.
Amen.